The last few weeks seem to have been filled with many tragedies, including the deaths of young children and states of emergencies called for some nations. And the call for mental health services has also been increasing. That's our topic this week for our Truth in Politics panel. Jennifer Lewitz is a policy analyst with War Shield based out of Saskatchewan, and Egon Sinclair is a columnist with the Winnipeg Free Press. Jennifer and Egon, thanks so much for being with us this week. Jennifer, first off, welcome to the Truth in Politics panel.
Hi.
A difficult topic for this first week for you, but as you know, there are many First Nations currently under a state of emergency. Many of those seem to involve mental health crisis issues related to violence, addictions. Can you give us a sense of what you're seeing in Saskatchewan?
Same thing. I think I just saw on the news the other day that there's a lot going up north in Saskatchewan right now. You know, we're seeing health providers speaking out because they're not able to give that proper care to the members of the nations because they're addressing emergency situations now. So violence, addictions, and stuff like that, which is also concerning because that means that our prenatal and people that actually need that support are not getting it because the attention is diverted over to the emergency situations.
Egon, what are your thoughts on what we're seeing out there?
If these were situations in cities, they would be dealt in a weekend because they would be resourced appropriately. They would be set up supports appropriately. The fact is that because these are communities that are often neglected, marginalized, forgotten about by not just the federal government, but the provincial legislation, because the provincial governments have the jurisdiction over healthcare, but particularly the issue of mental health. The fact is that chronic problems in communities never just begin on one season or 1 year. These are things that have happened over decades upon decades of neglect by the provincial health authorities over issues like jurisdiction of who pays for health services on First Nations, Jordan's Principle, and so on. So the fact is that this is a provincial issue that's been created by years and years and decades of neglect.
Jennifer, what do you think is behind some of these critical issues that we are seeing out there when it comes to the violence and the addictions?
I think the biggest thing is the socioeconomic issues happening on our nation. So, you know, there's a lot of mental health problems that are happening, but the problem is that there's not a lot of supports in place to help the people that need it. Even if you're in a city, you know, like I've had to access mental health supports in the past, even getting assessments and stuff done is hard to get on a good day. So for the people that are in nations, they're very isolated. Our youth are isolated. They don't have much. You know, there's families broken down. There's a whole lot of issues happening there. And the isolation, I think, is the biggest part.
Egon, you know, in the past few weeks here, we've heard about the deaths of 6 children and youth here in Manitoba alone. Do you think things are worse now for our children than they were, say, 10, 20 years ago? And what can we do to make sure our youth have a better life?
Well, it's difficult to tell because, I mean, the fact is that we're hearing more about these things because of social media and because of other platforms and so on. I think that things are chronically bad. I mean, the 2% cut, or the 2% cap, that was imposed by the Liberal governments way back in the days of Jean Chrétien and Paul Martin created exponentially emergent situations on First Nations. You know, I want to add one thing to what Jennifer said. Absolutely correct that there's this situation amongst youth. Even when there are services on First Nations that are mental health providers, and we do see some First Nations partnering with health insurance or, you know, in the Canada Life and in other insurance bodies and so on, getting adequate and competent health care is a big problem. People who understand intergenerational trauma from residential schools, understanding the very specific issues that Indigenous peoples deal with in terms of understanding basic things like land loss and how that permeates throughout decades upon decades of trauma. I mean, all of those things are the TRC calls to action, and dealing with those things is something that has to happen on a wide scale. So everyone's got to take this issue seriously. This is not about any one community. This is about a broad scale issue involving the survival of young people, but particularly that what ends up with issues on First Nations inevitably ends up in the healthcare system in provinces. And so, to reiterate, it was really the provinces really have to take a leadership role on this issue.
Jennifer and Egon, a big issue indeed to talk about. Appreciate you both for being here this week.
Yeah, miigwech.
Thank you.